So today we're going to be going through a review case of one of our patients from Denmark today. He's actually a very typical patient suffering from male pattern baldness. So he has a particular M shape at the very front of his frontal hairline he would like to have corrected with a hair transplant. So for this patient, we're doing both a hair transplant and an eyebrow transplant at the same time, only on one of his eyebrows that is missing just on the ends of his eyebrows. So from the picture you can see he's a very handsome young gentleman. So if you zoom in on his hairline, you can see that he does have a few hairs which are single hairs at the very frontal of his hairline where it's starting to thin out into the rest of the frontal furlock. We're going to be shaving into the area so that we can place grafts within his natural hair so that we can make sure that once the hairs have grown, it's going to look more natural and it's going to appear more seamless when he's brushing his hair or whether he's when his hair is wet. So in this picture, as you can see on the side of his eyebrows, that they're missing a few hair strands, which we're going to do a hair transplant of single hairs within this area according to the angle of his eyebrows. You can also see that in the frontal hairline, we are going a little bit deep within the area in order to make sure that we are able to. This picture is also a lot clearer, that we can see that how far his recession has gone into his hairline, and hopefully once the transplant is done, it's going to grow much thicker and it's going to appear like he's never had a recession in the frontal area. So in this picture is day one after the transplant is done. You can see that in the eyebrow that we have transplanted the hairs within the line to make sure that we don't do too much. These single hairs are going to grow a lot faster in comparison to the hair transplant. The results are going to be much clearer sooner for the patient. In the frontal hairline, we have created zigzags using single hairs. This is going to make it much easier for the patient to style his hair and look a lot more natural in comparison to a very straight implantation. You can clearly see that the area is a little bit red, so this is very common within the first 2 weeks, and this should become much more natural after the first 2 weeks is over. In this time, it's going to be very important for this patient to take care of his grafts using the shampoos and creams and medication given to him by the clinic.